You're already deep into the renal system. Great job. But the best is yet to come. These next questions could be the game changers for your NCLEX success. So stick around till the very end. Let's keep learning together. 51. A nurse is caring for a client with nephrolithiasis. Which intervention should the nurse prioritize? A. Administering antiemetics. B. Encouraging fluid intake of 3 to 4 liters a day. C. Applying cold compresses to the flank area. D. Restricting all physical activity. Answer. B. Encouraging fluid intake of 3 to 4 liters per day. Rationale? In nephrolithiasis, kidney stones, increasing oral fluid intake is a top priority to flush out the stones, promote urine flow, and reduce the risk of further stone formation. Adequate hydration dilutes urine and prevents crystals from aggregating. Antiemetics may be needed if nausea is present, but they do not address the root problem. Cold compresses are not effective for renal colic. Physical activity is often encouraged, for example, walking, to help mobilize the stone. Strategy. When managing kidney stones, prioritize actions that enhance elimination of the stone and prevent recurrence. High fluid intake is always a primary non-invasive intervention, unless contraindicated. 52. Which finding in a client with chronic kidney disease should the nurse report immediately? A. Hemoglobin of 9.8 grams per deciliter. B. Phosphorus level of 5.2 milligrams per deciliter. C. Weight gain of 3 kilograms in 24 hours. D. Fatigue after dialysis. Answer. C. Weight gain of 3 kilograms in 24 hours. Rationale. A rapid weight gain in a client with CKD suggests fluid retention, which can lead to pulmonary edema, hypertension, and heart failure. A gain of 3 kilograms, about 6.6 pounds, in 24 hours is significant and must be reported. Hemoglobin of 9.8 is low but expected in CKD due to decreased erythropoietin production. Phosphorus is slightly elevated but not life-threatening. Fatigue after dialysis is common. Strategy. Look for signs of acute changes that indicate decompensation. In CKD, fluid balance is critical. A rapid weight gain is a red flag for volume overload. 53. The nurse is reviewing a client's lab report and notes a GFR of 18 milliliters per minute, 1.73 square meters. How should this be interpreted? A. Mild kidney impairment. B. Moderate kidney impairment. C. Severe kidney disease, stage 5. D. Normal renal function. Answer. C. Severe kidney disease, stage 5. Rationale? A glomerular filtration rate, GFR, of less than 15 milliliters per minute typically indicates end-stage renal disease, ESRD. A GFR of 18 milliliters per minute falls in stage 5 CKD, meaning the kidneys are functioning at less than 15 to 20% of normal capacity, and dialysis or transplant is usually required. Normal GFR is 90 or above. 60 to 89 is mild impairment, 30 to 59 is moderate, 15 to 29 is severe. Strategy. Memorize the CKD staging based on GFR, as NCLEX frequently tests knowledge of progression. The lower the GFR, the worse the kidney function. 54. A nurse is caring for a client with a serum calcium level of 7.2 milligrams per deciliter in chronic kidney disease. What is the most likely cause? A. Decreased dietary intake. B. Increased renal reabsorption of calcium. C. Decreased vitamin D activation. D. Increased calcitonin production. Answer C. Decreased vitamin D activation. Rationale. In CKD, the kidneys lose the ability to activate vitamin D, which is essential for calcium absorption from the gut. Without active vitamin D, calcitriol, calcium absorption decreases, leading to hypocalcemia. Additionally, high phosphate levels bind with calcium, further lowering serum calcium. Dietary intake alone rarely causes such low levels unless compounded by poor absorption. Calcitonin actually lowers calcium. Strategy. Know how mineral imbalances occur in CKD. P. Learn in phosphorus. P. Build calcium. D. Vitamin D activation. This causes secondary hyperparathyroidism, a major complication in CKD. 55. The nurse is providing discharge teaching to a client with a history of calcium oxalate kidney stones. Which instruction is appropriate? A. Increase your intake of spinach and beets. B. Drink 2.5 to 3 liters of water each day. C. Avoid dairy products. D. Follow a high-protein, low-carb diet. Answer B. Drink 2.5 to 3 liters of water each day. Rationale. Hydration is the most effective strategy for preventing calcium oxalate stones, the most common type of kidney stones. Adequate fluid intake dilutes the urine and reduces the concentration of stone-forming substances. Spinach and beets are high in oxalates and should be avoided. Dairy is not necessarily harmful unless excessive. High-protein diets increase uric acid and can promote stone formation. Strategy. Identify preventative strategies based on stone type. For calcium oxalate, limit oxalate-rich foods, spinach, nuts, chocolate. Hydrate. Do not excessively restrict calcium unless directed. 56. A client with CKD is prescribed epoetin alpha. Which adverse effect should the nurse monitor for? A. Hypotension. B. Hypokalemia. C. Hypertension. D. Hypoglycemia. Answer C. Hypertension. Rationale. Epoetin alpha stimulates red blood cell production, which can increase blood viscosity, potentially leading to hypertension, a common side effect. It can also exacerbate pre-existing hypertension. Hypotension is not typical. Epoetin alpha has no direct effect on potassium or glucose. Strategy. When administering epoetin alpha, monitor blood pressure, hemoglobin levels. Avoid overcorrection. Keep HGB less than 12 grams per deciliter. Expect NCLEX to test both purpose and adverse effects of this drug. 57. Which of the following clients is at highest risk for developing post-renal acute kidney injury? A. A client with heart failure. B. A client taking nephrotoxic antibiotics. C. A client with an enlarged prostate. D. A client with dehydration. Answer C. A client with an enlarged prostate. Rationale. Post-renal AKI results from obstruction of urine outflow, and benign prostatic hyperplasia, BPH, is a common cause. The enlarged prostate compresses the urethra, leading to urinary retention and hydronephrosis, which backflows into the kidneys, causing damage. Heart failure and dehydration cause prerenal AKI. Nephrotoxic drugs cause intrarenal AKI. Strategy: know the three categories of AKI: prerenal, perfusion issue; intrarenal, tissue damage; postrenal, obstruction. Identify the cause based on anatomy and physiology. 58. A client with CKD asks why they feel tired all the time. What is the nurse's best response? A. You are probably not sleeping well. B. Your kidneys aren't making enough of a hormone called erythropoietin. C. Toxins building up in your blood make you sleepy. D. You should start taking more vitamins. Answer B. Your kidneys aren't making enough of a hormone called erythropoietin. Rationale: in CKD, the kidneys fail to produce adequate erythropoietin, which stimulates the bone marrow to produce red blood cells. The result is anemia, leading to fatigue, weakness, and pallor. Uremic toxins do cause malaise, but the primary correct explanation is anemia due to hormone deficiency. Strategy: use clear physiological explanations when the question asks for therapeutic communication. Avoid vague or blame-based responses like, "You're not sleeping enough." 59. A client has been diagnosed with polycystic kidney disease. What is the nurse's priority teaching? A. Avoid all protein-rich foods. B. Monitor and control your blood pressure closely. C. Take calcium supplements daily. D. You will need immediate dialysis. Answer B. Monitor and control your blood pressure closely. Rationale: in polycystic kidney disease, PKD, cysts grow in the kidneys and impair function. Hypertension is both a common complication and a driver of disease progression. Blood pressure control helps preserve kidney function longer and prevents cardiovascular events. A nurse is reviewing the lab results of a client with CKD. Which result should the nurse expect to be elevated? A. Hemoglobin. B. Calcium. C. Creatinine. D. Bicarbonate. Answer: C. Creatinine. Rationale: in CKD, the kidneys can no longer efficiently filter creatinine, a waste product of muscle metabolism. Thus, serum creatinine levels increase significantly and serve as a key indicator of kidney function. Hemoglobin and calcium tend to be low, and bicarbonate decreases as metabolic acidosis develops. Strategy: know which labs go up or down in CKD. Aproth, Buck-in. Aproth, creatinine. Aproth, phosphorus. Aproth, potassium. Aproth, GFR, don't dilide hemoglobin. Don't to calcium. Don't bicarbonate. NCLEX loves to test your ability to recognize these lab trends. If you found this helpful, don't forget to like, share, and subscribe. And remember, mastering these high-yield questions brings you one step closer to wearing that RN badge with pride. You've got this.